Hello and Assalamu alaikum ultrasound diagnostics. So this is the CBCT of the patient that you have requested. The area of interest is the lower left 8 for a cystic lesion and all the other wisdom teeth for extraction evaluation, starting with the upper right 8. The upper right 8, as you can very clearly see on the transaxial view right here, is not completely impacted but partially impacted, and it is very closely associated with the distal aspect of the seven. The roots are embedded into the maxillary sinus, even though they're not perforating, or no radiolucencies or sinusitis can be seen, but they're very closely associated, and multiple three roots with a curve in the parietal can be seen here, and also they have very close association with the distal aspect of the seven. Moving to the lower right eight, this is a horizontal impaction. This is also a partial impaction, but very well embedded into the bone. We've got a thick buccal and a lingual cortical plate, followed by the apical one third, very intimately in contact with the inferior alveolar nerve. Moving to the upper left eight, as you can see, the upper left eight is very similar to the upper right. It's very closely associated distoangular impaction, and distally it is associated with the 7, and the roots are very well embedded into the maxillary sinus. No sinusitis or radiolucencies can be seen associated. The difference in the upper left atrial, all the three roots are fused together, as you can see here. Now focusing on the lower left 8, we've got a cystic lesion associated, which you can see right here. This is could be an eruption cyst, doesn't seem like a or could be as a differential, could also be a dentigerous cyst that you can see here, because of the fact that the lining starts at the cemento enamel junction. This is a distally impacted tooth, horizontal completely, or a mesioangular impaction, and the roots are very well embedded into the uh, ramus of the mandible, and fused to the buccal cortical plate that you can see right here. So this wisdom tooth is not associated with the inferior alveolar nerve. However, the lingual cortical plate and the ramus thin out quite significantly along the borders. There you can see this is the axial view, or the top to bottom view. Here also you'll have a better understanding of the tooth. Both the lower wisdom teeth can be seen. This is the cystic lesion starting from the cemento enamel junction of the lower left 8 right here. So this could be a dentigerous cyst or could be an eruption cyst. This is the lower right 8, very closely associated with the inferior alveolar nerve.